and at retirechicago.com. Investment advisory services offered by McNamara Capital Investment Group, LLC, a registered investment advisor, insurance licensed in Illinois.
Attention maintenance coordinators. If you manage an industrial facility, then you know how critical it is to manage a consistent maintenance staff. During outages, when you're shorthanded, Vans has your back.
Hi, I'm Dave Van Camp, president of Vans Industrial. Whether you need one person for 8 hours or a large crew for a month, we can supplement your maintenance team. Our personnel are trained mechanics familiar with all material handling processes. Our expertise extends to fabricating, sheet metal, millwright, and ironwork jobs. Our men can work alongside your repairmen, or we can provide an entire crew complete with equipment depending on your requirements.
Vans uses only the best and safest union-trained mechanics, insured at the highest level, to perform the job right. Call 833-VANS-IND to schedule your maintenance team. That's 833-VANS-IND. Or visit vansindustrial.com. That's VANSindustrial.com. Vans Industrial, working safe since 1964.
AM 560, The Answer.
Top of the morning, Dan and Amy. Dr. Deborah Birx yesterday talking about where we're at with testing. This was at last evening's task force briefing. High marks to HHS for getting us to where we are now.
We are continuing to accelerate testing at a record rate. We now have 370,000 tests that have been done. The majority of those, over 220,000 in the last 8 days, which those of you who have been tracking the South Korea numbers put us equivalent to what they did in 8 weeks that we did in 8 days. This was made possible because of the HHS team working together, bringing together the strength of the FDA with the CDC and under the leadership of Secretary Azar.
And we are pleased now to be joined by aforesaid Secretary Azar, HHS Secretary Alex Azar. Thanks so much for being with us. Appreciate it.
It's great to be with you, Dan and Amy. Thanks for having me.
Well, it's no time to take a victory lap, but those numbers that Dr. Birx reported are certainly encouraging. Give us the trajectory of testing and what we can glean from the numbers that are coming in.
Well, this huge surge in testing is a result of the great work of CDC and FDA working with the private sector to stand up high-throughput screening, and the FDA has just been removing regulatory barrier after regulatory barrier. Just the other day, we've approved now self-swabbing. So, the original test, which the president has joked about, involved quite a long swab going deep up into your nasal and nasal cavity. Now you can actually yourself swab yourself and put it in a test kit, and it can be taken back. And, here's the big thing about that. That saves us personal protective equipment from those healthcare workers that would otherwise have been needed to stick that swab up into your nose. So we're trying to preserve everything we've got. And this information from all of this testing is going to give us even more robust data so that we, local governments and state governments, can come up with the right solutions for how to mitigate the spread of this disease.
Where can we get those self-swab kits?
So those are through healthcare professionals. So those are not yet, although we hope to get at some point to where it's very convenient, where you might be able to do kind of home testing. We're saying right now, even with high-throughput testing, America's industrial might of testing, the lab cores and the Quest, we still are saying we need to prioritize those inpatient hospital patients, because we got to find out whether they have the coronavirus, because we can get them out of the hospital if they don't, and we can make beds available.
A former FDA Commissioner, Dr. Scott Gottlieb, had opined in the Wall Street Journal that his expectation was that we'd be at 75,000 tests a day before the end or within the next week, is about what he said. And I wonder if that's an accurate statistic. And then also because of the high throughput that you mentioned, that we're going to be caught up, and then we're going to be able to get these results turned around so that on a daily basis we're up to speed.
Well, we've got rapid tests. We have plentiful tests. Testing really needs to come off the table in what people talk about at this point. We're doing over 50,000 a day, so if we got to 75,000, that's certainly within the realm of the possible. But the important thing is that the right people are getting tested, and then that the people who are positive are getting treated. The important thing to remember, though, is Almost all people who get tested do not have the novel coronavirus. Depending on the community you're in, globally, about 3% of people that get tested are positive. Of course, in New York, we're seeing higher numbers because New York is so much the epicenter, and you've seen such a high what we call attack rate, which is the sheer number of people infected per thousand.
Right, and so with respect to the testing, I understand you've got New York as the hottest hotspot with 8x the number of cases as the next highest state. But Tony Fauci said something yesterday at the briefing talking about the dark spots, the hot spots versus the dark spots. And ultimately, at some point, we want to move testing that's more sort of the getting representative sample size variety to the so-called dark spots, because you have still the possibility to do significant containment in places where there hasn't been an outbreak, like New York City.
Well, I think there's a misimpression there. Testing is nationwide. It's not in New York. Testing is out in over 91 public health labs. It's out in doctors' offices through LabCorp and Quest. It's out in pretty much any hospital that has a lab in the United States. It's out in private labs. Over 10 million tests are available just from the beginning of March till today out there in the marketplace. So there's no shortage of tests available. So there aren't dark spots, so to speak. That's not representative of what in fact is out there. Testing's occurring. We're getting data from around the country. It just happens to be that New York is the biggest hot zone that we have at the moment.
Well, I guess I meant it just in terms of the next tier, because what has been repeated is people who believe that they are symptomatic or believe they may have had exposure get tested. Those are the priorities. But getting to that next tier of testing people so you get a representative sample of the demography of a particular area. There's this Oxford study that's out now across the pond regarding Britain that suggests that maybe as many as half of Brits have already had the coronavirus. And so if that doesn't indeed turn out to be the case, then it changes our understanding of the lethality and the models that have been bandied about to this point.
Well, Dan, I've not yet heard about that study,
okay.
And so I don't want to comment on it, but I don't think that's representative of what we're seeing. Again, as I said, on average across the globe, less than 3% of people who get tested are coming in positive. So that seems to defy what you just related there.
Do you think we have enough?
And those are symptomatic people. Those are people who are presenting with fever or other symptoms of respiratory illness, and so these are your symptomatic folks.
Right.
And even among them, you're not seeing that kind of attack rate.
Right. No, I mean, and I understand Penn said that the other day. 1 in 10 in America right now that have been tested have tested positive, and that's an important thing to note. I was just trying to get a sense of symptomatic versus asymptomatic, and or perhaps those who have already had it run through their system and were asymptomatic. I just didn't know how important that next tier or that cohort was.
Well, the more important thing isn't all this obsession is the question about testing. The most important thing right now is executing well on social distancing and mitigating the spread of this disease, because even if you know you're positive, the advice is going to be to stay home and to distance from others. And so the really important thing is the president's leadership, both to contain the importation of continued disease from Europe, China, Iran, elsewhere, the spread internally, people who've been in New York recently needing to self-isolate if they travel elsewhere in the country, but then the community mitigation steps that we have asked all of our people to do, which is engage in social distancing, to engage in telework, to teleeducation, and to take the normal, usual precautions and take even more direct measures in the hot zones around the country. Because remember, these are locally led efforts. In the United States, public health, these responses are locally led, they're state managed, but they're federally supported with expertise and guidance and surge capacity.
Now, you were there for H1N1 in 2009. We all lived through that. And I don't remember, we had 60 million Americans who got H1N1, 270,000 hospitalized, and about 13,000 deaths. Is this just a more aggressive type of virus? Because I just feel like, it's constant 24/7 of panic. I feel like the media is creating a lot of panic here.
Well, I wasn't here at HHS for the H1N1. That was the Obama administration, and that wouldn't have been me.
No, I bet just meant like you were around, like you were.
As we look at flu and comparisons to flu, they're interesting in one measure because they tell us that even on the average flu season, we'll have 30,000 to 60,000 Americans who perish from the flu. But that doesn't mean, though, that one should in any way treat the coronavirus as anything less dangerous or severe than it is. This is quite a severe and quite an important public health challenge and emergency for the world. It appears to be highly transmissible, and it attacks individuals in particular demographics, especially the elderly and those with certain types of medical conditions that makes the mortality rates really quite high. And so while with flu we have a certain level of expectation about impact, the novel coronavirus goes on top of that, and it hits some of our most vulnerable populations in really extremely disproportionate ways.
I wanted to go back to what you mentioned about New York City and New York State and people who are leaving, that wherever they end up, quarantine for 14 days and be responsible so you're not taking the virus with you to another location. And how much of a concern that is for the federal government, and how much of how much coordination is going on between New York State and other state and local governments to try to make sure that the virus isn't being exported through people who are traveling.
Well, it is being exported, and that's the problem. So you've seen the cases move between New York and Westchester County, but then you've seen now the exportation of cases into northern New Jersey and then out into Long Island and into the Connecticut suburbs. And so it is, in fact, happening because people are not practicing and haven't been practicing the type of social distancing that the president has asked people to engage in, and home isolation. They're moving about, and they're bringing that disease with them, and that's why yesterday from the podium, the White House took the very strong measure of advising that anybody who's been in New York within the previous 14 days needs to self-isolate wherever they end up until they've been out of New York for 14 days and are not showing any symptoms. It's a very real concern.
He is Alex Azar. He is the United States Secretary of Health and Human Services. Secretary Azar, thanks so much for joining us. Appreciate your time.
Thanks for having me. Bye-bye.
Take care.
Thank you. And he joined us on our turnkey.pro answer line. Coming up on Chicago's Morning Answer,
we'll switch gears and talk a little bit about our economic health with Wall Street Journal's Steve Moore at 7:37.
But now let's head straight into that newsroom. Here is Mike Scott.
Amy and Dan, good morning. Good morning, everyone. Dense fog is